what are the common symptoms that generally people should be aware of, like before, like even they develop that, what should be generally all common women should be aware of?
See, as all the women experience menstrual cycle, it is usual to have some mid-cycle pain or some menstrual pain. That is normal around the menstrual time of the month. But if there is extreme amount of pain in during menstrual periods, or maybe excessive or extreme amount of bleeding during the periods, excessive period, then it might be due to endometriosis. Endometriosis, whichever women or the lady or even younger girls have it, so the most common symptom for them is chronic and dragging pelvic pain. And this pelvic pain don't seem to go away with common pain pills which we pop or which the doctors prescribe. Like common pills will not cure it, because it's a pain of that endometrium tissue growing into the nerves or of our abdomen, of our intestine, of our different other organs like we discussed earlier. So in that case, the pain will not go, and it is a chronic pain. You might have to visit your gynecologist or the concerned doctor many times, and it's a very troublesome disease. I usually tell to my patients it is as troublesome a disease as cancer. It is not cancer, so this also has to be clear to our audience that it is not cancer. So it is not life threatening as cancer, but it is troublesome like cancer. It troubles the person, especially if it is not shown attentiveness or given attentive cure to in the beginning. If we let the disease progress, then it becomes very, very painful as the disease progresses. So the symptoms, as just to make it a summary, symptoms are chronic pelvic pain, bleeding through the vagina, then infertility. And one thing which a lot of doctors while treating endometriosis seem to ignore is our gut issues. So if you are bloating, lower abdomen plane, no, constipation, as we discussed, the endometrium tissue, which should be inside the uterus, is growing inside the peritoneal cavity or other organs. So all the frequency of urination, issues regarding urine and bowel, like constipation, can directly be caused due to endometriosis and has to be addressed with.
Thank you for answering those insights, sir. I'm sure like every woman should be aware of these general symptoms like before experiencing it. So we have a question from Dr. Kshitalji. Can you please explain the line of treatment for this, both in surgical and non-surgical prospect of endometriosis?
Okay, we'll come to that. So before we come to that, I would just like to add one more important point. As we explained, why endometriosis happens. So we were talking about this fact that most of our doctors, our learned doctors, also seem to ignore while treating or managing patients with endometriosis is that our body has a microbiome, which I think you might be aware of, but for our common audience, I'll just brief in between. So our entire gut, starting from our mouth to our anus, and our lower urinary tract, and in women, the vaginal tract, this has a good collection of good bacteria, and that is called all the good bacteria which are there in actually millions, not just in hundreds or thousands. They're there in millions. They work in harmony with our gut, with our vaginal tract and urinary tract, and they form a microbiome. It's a community of the good bacteria which are living within us, and they work in harmony with us, and they increase our immunity, they increase our overall well-being, and they fight against the bad bacteria entering our system. As we are aware, there are millions of bacteria every day entering when we sit on a infected seat, or even if we, when, for example, for peeing, or when we ingest anything, there are lots of bad bacteria also going on. So there is a constant fight between between the good bacteria and the bad bacteria, and the good bacteria is on our side, on the body's side, and they're fighting against the bad bacteria. So if we can maintain the gut microbiome, which includes the vaginal microbiome also, on towards the healthier side, then we can ultimately prevent endometriosis and also treat endometriosis in ladies and women who already have endometriosis. So this is an important thing because the latest studies, and there have been so many studies which have been pointing out that the vaginal microbiome, there are now tests also for gut and vaginal microbiome, where you can, through some samples, you can test what good bacteria in which concentration, how many millions of good bacteria, and which strains of the good bacteria are there. So by studying that and by prescribing the required pre and probiotics, there are lots of good newer products, companies, even non-pharmacological products, which help us maintain our good bacteria and the good microbiome, both the vaginal and the gut. But most of it is affected by our general day-to-day hygiene and our by our proper healthy diet. So for especially for women, the microbiome gets disrupted when we use a lot of intimate wash for hygiene of our vagina and our lower part for the women. So some people tend to use the soap or the different kind of intimate wash very harshly. So that also disrupts the microbiome, and different kinds of urinary tract infection, again in because our vagina and our urinary tract are very close to each other, so it disrupts the microbiome that side also. So, as some to answer the question, what are the surgical and the medical management?
Yes.
So, first of all, anybody suffering from endometriosis should visit their doctor as soon as possible, because it's a complicated disease and it should not try and self-medicate themselves. As I already told, simple pain, just chronic pain which is not being cured or being benefited by popping normal pain pills by local doctors or pharmacological chemists, which people do self-medicate. So if it is not curing, then you have to get an ultrasound done. You have to visit your gynecologist and understand what is going on inside, why the pain is not relieving, and why the pain is in so much intensity. So once you visit a doctor after doing some tests, there are some medicines, some hormonal medicines which can reduce our progesterone overload, which can increase our progesterone overload hormones and decrease our estrogen hormones. So these things can help the patients through medical management also. In early cases, can be there are some tablets, there are some injections also these days available which change the hormonal balance, which improves the hormonal balance so that the endometriosis can be cured. And once we were discussing like endometrium, for example, has grown inside the ovary, and then the ovarian it's called an ovarian endometrioma. There is infected endometrium layer inside the ovary. That too, if it is smaller in size, then it can again be treated medically. But in the extreme cases, bigger masses, and the major issue with endometriosis, which we discussed, was inflammation. The endometrium layer inside the ovary or surrounding the ovary, it infiltrates around the surrounding structures in like the bowel, the bladder, the urinary tubes, and everything gets stuck. As a surgeon, I am a laparoscopic surgeon, so I treat a lot of endometriosis laparoscopically. So once we go inside laparoscopically, open surgery is a very bad option because everything is absolutely stuck. And in open surgery, the uterus, the urinary bladder, and the tubes and the intestine, if stuck together, open surgery becomes a very blind surgery and very invasive surgery for the patients. Can lead to bowel injuries. So laparoscopy surgery is is the best tool to do anything surgically. And in that, we slowly, meticulously, we can dissect off the tissues and try and remove the infected endometriomas. So the person who asked the question, I hope I have answered their query.
Thank you for answering that, sir. We have one more question. What is the impact of hormonal birth control on menstruation in women with endometriosis?
See, as I told you, impact of hormonal birth control pills are overall not a natural thing. First of all, everybody knows about that. Sometimes in emergencies, obviously it is needed and it can be taken. That's not a problem. But chronic use of again, repeated chronic use of OC pills or hormonal birth control pills can worsen our hormonal balance, and in turn leading to worsening of endometriosis. And it's one of the causes of hormonal disruption in women, which is ultimately one of the leading causes of endometriosis, why the endometriosis happens in the first place. So it's a definite no again. You should not try and self medicate. Somebody asked, is endometriosis directly related to menstrual cycle? So, endometriosis, as I explained, I'll explain once more, Neha. Hi, Neha. It's a very good question. in our menstrual cycle, what happens is the endometrium layer inside the uterus, it is expelled out through our menstrual period, and the infected, the degenerated tissue has to be removed from the body, which the body does naturally. But in endometriosis, this hormonal tissue is outside the uterine cavity, and there is no exit place for that. So whenever the menstrual cycle happens, as you know, there is a hormonal change which is happening in the 28-day cycle, and so the hormonal cycle happens, and then obviously then the day of the menstrual cycle comes. So endometriosis symptoms and issues peak at the menstrual cycle. They are the worst during the menstrual cycle. So it is definitely related to menstrual cycle.